Thank you, everyone. It gives me endless pleasure to welcome you all. A very good evening to one and all present here today. I'm sure you all had a wonderful and healthy day. And now we are here to give you a wonderful evening too. We will make sure you enjoy this evening and get rich with lot of knowledge about your health. This is Vinny Sandhu from IWSA headquarters for conducting today's program. I thank you all for being here with us today. I would like to share with you all our today's program. That is, it goes like this. I had the privilege of giving a short introduction about our organization, that is Indian Women Scientists Association. Next will be Introduction to Science Awareness Program and Science and Our Life. Our President, Dr. Lalita Dhareshwar ma'am, will welcome and introduce our today's speaker, Dr. Aabha Nagral, who is a prominent doctor in her field. This will be followed by the most awaited talk by our speaker, Dr. Aabha Nagral. After the talk will be question and answer session between the speaker and the participants. Last but not the least in the agenda is the vote of thanks. So now I take your permission to introduce our USA to all the old and the new participants of today's webinar. Friends, USA, that is Indian Women Scientists Association, is all India social welfare, voluntary, non-profit, non-political, charitable, secular organization. Our objectives were displayed in the rolling slides, like taking science to masses, developing a scientific temper in the society, understanding the problems of women in sciences, and many more. The journey of USA started in June 1973 when 12 founder members, all women scientists, came together to promote science to masses. So they worked together and completed the first step of registering IWSA. Their vision was to take science to society using science and technology for the upliftment of the not so privileged ones. Friends, these were those days when they did not have any place to hold their meetings. But still, they conducted a conference where the then Prime Minister of India, Mrs. Indira Gandhi, was invited as the chief guest. Their hard work and dedication is seen today. We have a glorious campus on a huge plot of our own. Over the years, feathers are added to this organization and it is still going on. Even today, we have our founder member, Dr. Sudha Padya ma'am, present here for this webinar. We all welcome you, ma'am. Thank you for joining us. And friends, they are the members who are always there with us, attending most of our webinars and encouraging us all the way. Thank you, ma'am. At present, we have 11 branches all over India with its headquarters in Vashi, Navi Mumbai. We are running many science education programs like science exhibitions for school students, lecture workshops, and refresher courses for researchers, popular science lectures at colleges supported by BRNS, member enrichment program, computer center, etc., etc. We also run programs under society welfare programs. We have working women's hostel, daycare center, nursery school, library, reading room, health center, early child and childcare education, and many more. Under Science Awareness Committee of USA, we started Science and Our Life lecture series. Our first series was inaugurated on 20th of July 2020, a year which made all of us tech savvy. Since then, people from all walks of life decorated this stage. Under this, we had prominent speakers like Dr. Tessie Thomas, the Missile Woman of India, Padma Shri, Professor Rohini Godbole, Dr. Astrid Lobo Gajiwala, Dr. Anita Pillai, Dr. Bindu Menon, and the list is a long one. Each one of them are well known in their own fields. Today, our 11th talk is by Dr. Aabha Nagral. Friends, these webinars are connected once a month, mostly on second Saturday, and they are open to all. For more details, please do visit our website, which is iwsa.net. I request you all, please join us as a member of USA. Forms are available on our website too. I feel proud to be the part of 11th talk by Dr. Aabha Nagral on a very interesting and important topic, that is, how do I protect my liver? Now, it's the time to call upon our President, Dr. Lalita Dhareshwar ma'am, for welcome address and to introduce our honorable speaker. I will like to take this opportunity to say a few words about our President. Dr. Lalita Dhareshwar ma'am is a former senior scientist, Raja Ramana Fellow, BRC, Mumbai, where she has worked for 45 years. Ma'am was the head of Laser and Neutron Physics Division of BRC. Dr. Lalita Dhareshwar ma'am was instrumental in carrying out prestigious projects all over the world. I should not forget another feather of her personality. Ma'am is a spiritual trainer and a member of Shri Ram Chandra Mission. She has strived to impart spiritual training through meditation. Ma'am has also conducted and formulated many value-based education programs for the schools and colleges in Maharashtra and Gujarat. Now I request Lalita ma'am to take over. Ma'am, please.
Thank you, Penny. Thank you very much for this kind introduction, and very good evening to all the participants of today's program. And Dr. Aabha Nagral, I welcome you heartily and extend to you a very warm welcome on behalf of IWSA members. I would like to now introduce Dr. Aabha Nagral to all of you. She has such a glorious, such an impressive resume. I really had to pick and choose some of that because it's a very long one. Dr. Aabha Nagral is trained at the Sage GS Medical College and KM Hospital for undergraduate, postgraduate, and super specialty degree in gastroenterology. She went on to do a fellowship in hepatology and liver transplantation at the Royal Free Hospital, London, and Mayo Clinic, USA. This was possible through the P.N. Berry Scholarship granted by the UK High Commission. She is an MD in medicine, specialized in gastroenterology with special interest in adult and pediatric liver diseases and liver transplantation. She has been practicing since 1992. She is the founding trustee of the Children's Liver Foundation, an NGO creating awareness and helping children with liver disorders. Dr. Aabha Nagral is one of India's leading hepatologists, liver specialists, based in Mumbai. Having an experience of nearly 30 years, she has been successfully treating patients of all liver diseases from India and abroad. She is skilled and known for solving complex problems in her field of specialization, which includes liver diseases and liver transplantation in adults and children. She has been one of the earliest doctors in India to focus on hepatology and pediatric hepatology. and has been instrumental in setting up the first liver transplant program at Jaslok Hospital and subsequently at Apollo Hospital, Mumbai. She was involved in the first successful pediatric liver transplant in Western India. She has been involved in research and academic activities at national and international level since more than 2 decades and has authored more than 100 indexed publications and written several textbooks and book articles and reviews. Currently, she is the senior consultant hepatologist and liver transplant physician at the Apollo Hospital, Navi Mumbai and Jaslok Hospital, Mumbai. More than her expertise, she is an epitome of empathy and compassion, arousing confidence and a feeling of well being in her patients, which I know from my own personal experience. These qualities, as well as her expertise, sets Dr. Abha apart from the other doctors. As we can say this, I can say this with conviction that she is indeed a God's blessing to her patients. We are indeed fortunate and honored to have you, Madam Dr. Nagral, with us today amongst us. We are really grateful to you, Doctor, for agreeing to address the members of the Indian Women Scientists Association and our other guests, in spite of your very busy schedule. We are indeed thankful to you, ma'am. So I would now like to request you to present your talk in this assembly. Thank you, ma'am. Yeah.
I will make a small request to the participants, ma'am.
Yes, yes.
Yeah. Thank you so much, Lalita ma'am, for elevating us about Dr. Aabha Nagral ma'am. A gentle reminder to the participants, please keep your mics on mute and the cameras off during the talk. And I also request you to post your queries in the chat box, which will be answered after the talk, after Madam finishes her talk. Thank you everyone. Dr. Abha ma'am, please, we welcome you. Please, you may start your presentation.
Yeah, thank you. Thank you, Dr. Lalita and IWSA for this invitation. It's really a pleasure to be speaking among scientists, something which we don't do often. So it's different. It's a different a group of participants, and it's always different and nice to be in a setting which is different from your routine. There are fresh set of questions, a new approach to everything. So I think I look forward to the questions also. It was also nice to know about so many activities of IWSA. I was not aware that they're involved in so many activities and so many good. I didn't know about the nurses school and your, the other educational programs. And I look forward to being a part of this organization in the future. So I'll do that for sure. So I'll start with my talk, and I chose this topic because, as I was introduced, my main interest is in the liver. And I thought that the best way would be to talk about prevention rather than treatment, because there's a multitude of liver disorders, and prevention always is much more, what should I say, a better option than going for cure. So let's just start the presentation. I'm not very familiar with Google Meet, so I'll try and get my presentation online. I hope I'm able to do it. Okay,
Fantastic.
sorry.
Yeah.
We know that liver is a very important organ, and it's appropriate that we talk about its protection. Before I go on to the liver, I thought that since we are women scientists here, it will be appropriate to talk about the first Indian lady doctor, Anandibai Joshi. She was written about recently when we celebrated her birth anniversary. And she was indeed one of the first women in the 1860s who was able to pursue her interest in medical education by going to the US with a very supportive husband, and was able to train and come back. And therefore, I feel that it's important to talk about her. Unfortunately, can you imagine that way back in the 1800s when women were hardly being educated. Here was a woman who actually wanted to become a doctor and was able to succeed in doing so. So I thought I'll just start off by talking of a lady doctor. Doctors are obviously scientists first, clinicians later, and it was appropriate to introduce her in this talk. Coming back to my topic, functions of the liver. Now we know that the liver is a very complex organ and a very versatile organ, so to say, a vital organ nevertheless. It produces proteins, like one of the important proteins which the liver produces is albumin. It also produces clotting factors. So if the liver doesn't work, the blood does not clot. It has a very important role in production of bile, and we know that bile is necessary for absorption of fat and fat soluble vitamins like vitamin A, D, E, and K. So when there are conditions which cause obstruction to the flow of bile, we do not have bile or we do not have fat and fat soluble vitamins being absorbed. It stores food. So in periods of starvation, it is the liver which comes to the rescue to release nutrients into the circulation. It is the first port of detoxification, which means that whatever junk we eat, it comes into the gut, and from the gut it is absorbed through the portal venous system, which first stop is at the liver. So the blood from the gut through the portal vein comes into the liver, and that's where it gets detoxified first, and then it gets released into the circulation, goes to the heart, and then is supplied to the rest of the body. So it's the first stop for detoxifying the toxins, the junk, and whatever is unnecessary in the body. And it also regulates many hormone functions. Now, what are the important causes of liver disease? We know that almost every other patient nowadays that we see in the OPD has a fatty liver, and I'll talk about fatty liver in more detail. Then we have various viruses. So there are certain viruses which directly affect the liver, multiply in the liver. So we have viruses A, B, C, D, and E. And then there are other rarer viruses which affect liver as part of the other organs. So we have cytomegalovirus, herpes virus, etc. There are many other viruses. But the viruses which we will talk about, which primarily multiply and affect the liver, are the viruses from A to E. Alcohol, whenever one talks of liver disease, the first thought which comes to your mind is whether the patient consumes alcohol. But though it is an important cause of liver disease, it's not the only cause. So when you talk of cirrhosis, the first thought or the first question people ask is, are you an alcoholic? And this is one myth I want to remove, that it's not just alcohol. There are so many problems with the liver. You may have a newborn child with cirrhosis. So cirrhosis can affect due to multiple causes, and alcohol is just one of them, though it's one of the common causes. There are many drugs. This is a very underestimated cause of liver disease. And so you have drugs right from simple painkillers, day-to-day painkillers which one uses, which can affect the liver, day-to-day antibiotics which one uses, which can affect the liver. And there's a whole list, chemotherapeutic drugs, etc., so on and so forth. So this, and now one new phenomena which we have seen during the COVID times is that people are taking a lot of what we call CAM, complementary and alternative medications, and there are lots of patients who come down with liver toxicity from these drugs. So, everything which is allopathic may not be good, but everything which is Ayurvedic is also not necessarily good. So this is one thing I want to really highlight. It is kind of assumed that if you are on alternative medicines, they are harmless and they will not affect the liver, but that's far from true. Just as you can have side effects with allopathic drugs, you can have side effects with the other drugs as well, the Ayurvedic and homeopathic medications as well. And then there are other causes like autoimmune, malignancy, and genetic causes. I'll talk about the first four, which are more common. So coming to probably what now is the commonest cause of liver disease, which we see as of today, it's fatty liver disease. Here is a picture of a normal liver. And by the side, you can see that this is a fatty liver. It's an enlarged liver. It's yellow in color because it's full of fat. And if you look under the microscope, the fat globules are seen as these empty spaces, what is called non-alcoholic fatty liver disease, because this was differentiated from the fatty liver disease which you got from alcohol, because alcohol also causes fat to accumulate in the liver. So you can have fat because of alcohol, you can have fat because of what is called non-alcoholic fatty liver disease, you can have fat because of drugs. So many causes of fat, but most two important are fatty liver due to alcohol and non-alcoholic fatty liver disease, which is what one encounters very commonly. Now, it could be simple deposition of fat in the liver, or it could cause what we call inflammation and swelling of the liver cells, which is called non-alcoholic steatosis. Steer means fat, hepatitis. So when we say hepatitis, any itis in the body means inflammation or swelling. So there is swelling of the liver cells. It is not just simple fat. And you can see there are these blue dots which you see are the inflammatory cells in the liver. And then this can lead to scarring of the liver and subsequently cirrhosis. So as I said, it has become now the #1 cause of chronic liver disease and #1 indication for liver transplants. So this is something which we will dwell on in a little more detail. Now, what exactly is this non-alcoholic fatty liver disease? It's not merely a liver disease. It's actually a surrogate marker of what we call the metabolic syndrome. Now, what is this metabolic syndrome? There's a new term for non-alcoholic fatty liver disease. People are referring to as metabolic dysfunction related liver disease, because it's not just the liver disease that the patient has. In fact, it's just the tip of the iceberg. What the patient has is insulin resistance. And this is something which is inherited. So non-alcoholic fatty liver disease is an inherited condition. It's something which we do not realize. We only talk of some rare syndromes as a cause of inherited liver disorders, but this is the most inherited liver disease. So if you have a patient, if you have a person in the family who has diabetes, hypertension, is obese, has abnormal cholesterol and lipids, and heart disease, thyroid problems, PCOD, all these, or obstructive sleep apnea, all these are part of what is called insulin resistance or metabolic syndrome. And you can have patients who have fatty liver disease who can have one of these or more than one of these. So it's a big syndrome, and you will invariably find that if somebody presents to you with fatty liver disease, one or more of his family members would have one of these conditions. So if you have a 25-year-old coming to you with a fatty liver, it's a good chance have high cholesterol. So it's something which is under one umbrella called metabolic syndrome, which is something we need to address. So fatty liver is just a part of that metabolic syndrome. Now, this was a study from All India Institute where they looked at patients who came, and how are we diagnosing these patients? These patients are being diagnosed incidentally. Most of them have no symptoms. They are going for people are going for blood checks and regular health checkups nowadays. And what you find is their liver tests are slightly abnormal. And when the liver tests are abnormal, they are asked to do an ultrasound. When they do an ultrasound, there's a fatty liver there, and that's how it gets diagnosed. Some of them may have pain in the right upper side of the abdomen. That is where the liver resides. And they can have a dull, stretchy kind of pain because the fat in the liver kind of stretches the capsule and causes that discomfort. So this study from All India Institute looked at the causes of high liver tests, what we call liver enzymes, SGOT and SGPT, and they found that the commonest cause in patients who had high SGOT-PT was indeed a fatty liver disease. Now, what is the prevalence of fatty liver disease in the country? Now, you can see this. Various parts of the country have looked at their general populations to assess and look at the high numbers. These are numbers in the general population. So if you were to average it out, the 20% prevalence of fatty liver disease means every 1 in 5 people in front of you would have a fatty liver. So that's a huge population, huge. And this is something we really need to address and change. So now, is it necessary that one has to be obese to have a fatty liver? Not necessarily. This was a very nice study published in one of our top journals, Hepatology, from Kolkata, where they looked at fatty liver disease in a rural population, and they found that quite a few of them had a body mass index of less than 25. So that is 75. Three-fourths of that population had a body mass index of less than 5. So they called it lean NASH. So lean means these patients were not obese, and they still had fatty liver disease. So though it's much more common in obese people, you could have a person who's not obese and yet has a fatty liver. That's what this study taught us, and therefore that also needs to be addressed and looked for when somebody comes with high liver function tests. So what is the natural history of this disease? So it's a global burden. It's not just a burden in India. It started in the West, but is very much like 10 years ago, we did not speak so much of fatty liver disease in India, and we thought it was mainly a Western problem. But that's far from true. It's a global problem now, and India is very much affected. In fact, India may be the diabetes capital of the world, and therefore the two are very closely linked. So you have patients who have just fat, what is called steatosis, which can progress to what we call non-alcoholic steatohepatitis, that is fat with inflammation. Now, this can progress over a period of 88 years in about a quarter of them to cirrhosis. So what we are worried about is this. If you have what is called NASH, how do you diagnose NASH? The patient may have abnormal liver function tests, but even if the liver function tests are not abnormal, we do tests called a fibroscan, which tells us the degree of scarring or fibrosis in the liver. And if that is there, then there's a higher chance that this patient will develop cirrhosis. And all this happens over many, many years. So somebody who's known that he has fatty liver disease, which 20 years ago, a 50-year-old comes and says, I was diagnosed to have a fatty liver disease at the age of 30, may actually come at the age of 50 with a cirrhosis when his ultrasound is done. So it takes a long time for progression. And from cirrhosis to development of complications of cirrhosis, what we call decompensation, in another 8 years, another quarter of them will decompensate. And finally, it can lead to mortality. Now, what I want to highlight here is the cause of death in these patients is not really the liver in most of them. The cause of death, as I said, it's a part of metabolic syndrome, is usually heart disease, followed by malignancy. We know that patients who are obese in general have a higher incidence of all cancers, not only liver cancers, but cancers, other cancers in the body as well. So the top two causes of death in patients who have fatty liver are heart and liver and malignancy, followed by liver-related mortality. And then these patients can develop liver tumors. Any patient who has liver cirrhosis has a higher chance of developing cancerous tumors, what we call hepatocellular carcinomas in the liver, and the prevalence is about 1% per year. So we always like to screen patients with liver disease every 6 months with ultrasounds and tumor markers to see if they are developing any cancer in the liver or not. Now, if you look at the statistics of obesity, most of the obesity in India is truncal obesity, which is the worst kind of obesity. Because if the waist-hip ratio is high, which means that the waist is far bigger than the hip, then it means that there is a lot of fat deposited in your vital organs. So the waist circumference in a way is a surrogate marker for the amount of fat in important organs like liver, pancreas, etc. Now, if this is the figures from India, so only about 15% are underweight or normal weight, and 85% are either overweight or grossly obese. So this is a real scary statistic, and I mean, this is something which we never imagined. We always think of India as people with malnourishment, and I can say one thing, that obesity can also be in a way described as a malnourished status. So it's not always being thin, and you know the pictures which we have of famine-struck people with who are thin and skin and bones. Even obesity, in a way, is a form of being malnourished. So how do we manage this condition, non-alcoholic fatty liver disease? It really needs a multidisciplinary approach. You, of course, need a dietitian to have a patient lose weight. Very important is the role of a psychologist, because it's your psychological makeup which decides what you eat and what you put into your mouth. And unless that is changed, the diet is not going to change. We need a physiotherapist who can tell you the right exercises, especially if you have advanced disease. And then there are physicians who can manage your blood pressure, diabetes, heart disease, which often accompany these people. Rarely you may need a bariatric surgeon, a liver specialist, and finally you may need a transplant surgeon if the disease has progressed beyond cirrhosis to decompensation. So it's a intensive management by these various people which is required in managing this condition. And primarily the mainstay of therapy is changing the lifestyle. And what is the lifestyle problems which are associated and which we are seeing more and more in our country? So especially with the COVID, we saw that anyway fast foods, various food chains have become popular. Western diet has become popular. People with the COVID have become more homebound, more ordering more food online. Everything is online based, everything is mobile, social media based. And that is really, in a way, worsening our lifestyle. There's no exercise. People are just stuck to WhatsApp and various other social media, the new ones coming on every now and then. And very little motivation for exercise and sports. Schools are going online, so the children are sitting glued to their mobiles or laptops studying. So it's in a way a kind of the pandemic has, of course, as somebody said, that it has taught us how to use technology better, but it has had a lot of damage as well. So basically we need to change lifestyle. So most important is to reduce weight with the help of diet and exercise. And there are a whole lot of fads, so to say, in the market. People go for colon cleansing and all kinds of abdominal fat reduction agents, herbal supplements. One of them is Herbal Life, which I've seen quite a few patients take, and there have been reports of Herbal Life actually causing liver failure. So I would say that do not go for any supplement. These offer quick fixes and therefore seem attractive, but really there is no shortcut to reducing weight, and one has to really make an effort in form of diet and exercise to reduce weight. And then there are certain drugs, but drugs are not very effective. The final thing really to help in these patients is weight reduction and lifestyle modifications. So if you lose about 5 to 10% of weight, that is, we suggest no crash dieting, half to 1 kilo loss per week. It does make a big difference, and I'll talk about in a minute. So what is the dietary recommendation? So you calculate the ideal body weight based on your gender and your height, and based on your ideal body weight, measure the number of calories per kilo which you need to eat. So 50 into 25, 50 kilo person into 25, which means 1250 calories per day would be the ideal, will be the number of calories. Then you have how much of it is coming from carbohydrates, what type of carbohydrates, proteins, and fat. And we know that we want to reduce the amount of saturated fat in the diet. So how does one calculate? As I said, you have online calculators. Fatty liver disease runs in families. When you see a patient, a 25-year-old coming with his parents who is obese, it's very likely that his parents are also obese. So you see the age. So if you have a 57-year-old female whose height is 160 centimeters, just put in these and you get, there are various formula, take an average, what the ideal body weight should be. And then based on that, calculate the calories. What is the diet? Now there are various diets, various fats. You have the Dikshit diet and you have the Rujuta Divekar diet. But I would say rather than one specific diet, basically it is good to individualize the diet. So a good diet is one which includes modify that. But in general, we say reduce the rice and wheat intake. Now, generally people believe that rice, eating rice makes you gain weight, but eating wheat also is making you what you call a wheat belly, makes you put on weight. And we prefer millets like jawar, bajri, nachni to wheat to reduce weight. The other important culprit is processed food. So just tell the patient avoid eating anything which is processed and ready-made. Fruit juices, people generally associate fruit juices with good health and nutrition, but no, it's always better to eat fruit with all its fiber than a fruit juice which is processed and where all the fiber has been removed. Adherence to diet is a challenge, and that's where I said you need a psychologist. So whether one should take small frequent meals or intermittent fasting, as I said, just go by your regular diet. Small frequent meals seems better. Avoid crash diets. So there are, you've heard of all kinds of diets, the keto diets and the Atkins diet, etc. But I would say best is to sit with a dietitian, mention to her what your diet is and let her modify it rather than going by some named diet. But if you were to go by a named diet, the diet which has been shown to help is what is called a Mediterranean diet. And what is this Mediterranean diet? It has more of fruits, vegetables, nuts, seeds, and of course fish. They believe in a lot of olive oil. Indian type of cooking is not very conducive to using olive oil except for some shallow frying, but a lot of olive oil is polyunsaturated fat, which is thought to be the better form of fat, and this is really the diet which is encouraged. So more of fruits and vegetables, fish, seeds is a good diet. And black coffee has been shown to be protective as far as fatty liver is concerned. Now, just certain do's and don'ts. Avoid snacking. We think of a snack as a light in-between meal thing to take, but they can be full of calories, and then it's always tempting to have more than one vada pav, and that's where the problem really starts. So avoid snacking, rather have small, decide what you're going to have between meals so that you don't get hungry, don't fill up your belly completely, leave it a little empty, but eat more frequently, and decide what is going to be eaten between the meals. So it could be a small fruit or some nuts rather than snacking on these kind of things. And I think the trick is not to have these things in front of you, not to have any sweets kept at home, because once they are there, it's very tempting to resist eating them. And here are just some examples of how just eating one slice of pizza is 230 calories. You have to walk briskly for 30 minutes to lose around 100 calories. So you'll have to really walk for a one good hour at least to make up for that one slice of pizza you have, so on and so forth. So just to say that there are many apps which are available, which even for Indian foods, which will tell you how much you are eating, and it will keep your calorie check in count, because these small snacking in between actually is what is more harmful. What about exercise? So we say cardio, where you basically increase your heart rate when you exercise, like running or jogging or walking on the treadmill or swimming. And it depends on whether you can spend more time or you are not able to spend that much time. And of course, all this is provided your heart permits. So always, if you have a heart issue, talk to your cardiologist. But if you want a moderate intensity exercise, which means 3 times a week for 45 minutes is what is recommended. One can calculate, you have to achieve a target heart rate. So how do you calculate the target heart rate? It is a maximum heart rate into 0.7. What is a maximum heart rate? It is the figure 220 minus the age in years. So if your age is 20, your maximum heart rate is 200, 220 minus 20. So maximum heart rate 200 into 0.7. So that will be your 140, will be the target heart rate which you want to achieve when you exercise. Similarly, for a high intensity exercise, because it's high intensity, you can do it for a lesser amount of time and then calculate the maximum heart rate. So here the heart rate is going to go higher. So all this under supervision if there are any cardiac or other hypertension kind of issues. So you all can calculate your own target heart rates based on this simple formula. Also, you need not just what they call cardio, but resistance exercises. So cardio helps you to lose weight, but resistance exercise is what increases muscle mass. So basically what you want to do is increase your muscle mass and reduce the fat. And this can be done very easily at home. There are many things on Google. We use Google for all the wrong things, but there are many good things on Google. So there are workouts, because all the time when I tell patients that you need to be exercising, they said no, in the lockdown we could just not step out of the house, we were at home only. But there's a lot one can really do at home. So weight loss, so you may say that if somebody is thin, why do they need to exercise? It's not only about losing weight, it's about building muscle mass. And you may be thin, as I told you, but you will have, if there is fat in your vital organs like the liver, you need to lose that fat. Not just that, exercises actually help you in improving your cardiovascular fitness, taking care of improving your hypertension, diabetes, cholesterol, and the fat in the liver. So everything gets better. Your diabetes drug doses comes down, your blood pressure medications requirements come down, your lipids improve. So everything improves with exercise. So just to keep fit, not only weight loss, you need to exercise. Role of lifestyle modifications, yes. As I said, if you lose 3% of weight, you lose the fat in the liver. If you lose 5% of your baseline weight, 5 to 7%, you lose the inflammation in the liver. And if you lose more than 10% of your weight, the scarring in the liver can actually reverse. So it has been shown that weight loss is the most important treatment for a fatty liver disease. Now, switching gears, after fatty liver, I'll talk about the other common problems. Acute viral hepatitis, it could be acute or chronic. So as I said, we have the 5 common viruses, A, B, C, D, and E. The ones which we commonly see in the population when somebody develops jaundice or infective hepatitis is hepatitis A, which is more common in children. And hepatitis E is almost the most common cause of hepatitis in adults. So whenever you have epidemics of hepatitis, or if you hear somebody has developed jaundice, the most likely cause in an adult is hepatitis E, and in a child is hepatitis A. Now, both these are transmitted by what we call the fecal-oral route, which means that the virus is excreted in the stools, and then you have, say, flies. We have people defecating in the open, so you have flies sitting there, and you have the same flies sitting on your sugarcane juice, and then you drink it, and that's how it spreads. Most important source of spread, which we do not realize, is water, and I'll talk about it in a minute. So we have to be very careful about water. The other viral hepatitis, B, C, and D, are the ones which can become chronic, and these are mainly spread through other modes. They are not spread through food and water, but they are spread through, say, mother to child at the time of delivery, or through sexual transmission, or what is called horizontal transmission. That is, you have one child in the family who's positive, other child can become positive without it coming from the mother. It could come from the father. That is because hepatitis B is a very infective virus. It is more infective than, say, the HIV virus, and it can be transmitted or be present in the saliva as well. B and C are mainly what we call parenteral transmission. That means through needle and other routes, and I'll talk to it about it in a minute. D is an incomplete virus, always occurs with B, is never alone. So how can we prevent transmission of these viruses? I just spoke to you. So avoid any drinks with ice and water, or any food with water. We know that this pani puri wala is not going to be using your bottled water, mineral water, boiled water. So I think street side eating of such foods should be avoided. I know these are the most, what should I say, lip smacking foods. And but the problem is not the food itself, but the way, the chances of contamination of these foods. Now, even if one were to drink have a juice with ice in it in one of a good restaurants, we are not quite sure about the water and ice that has been used. So again, if one were to avoid, one would avoid any ice or water containing drinks from outside. Now, how have the hepatitis E epidemics occurred? They have occurred by contamination of the drinking water pipe with the switch water pipe, and switch water pipe and drinking water pipes often run together. Any kind of leakage can contaminate the drinking water, and that's how epidemics of large populations have known to occur. So we remember it as E for epidemic. So most epidemics of hepatitis which you see are epidemics of hepatitis E. Now, hepatitis B and C can be transmitted through other means, and these are the means which are not very obvious. We know they can be transmitted through blood. Blood is often always screened, so it's a less important mode of transmission. But other modes which are subtle modes and not obvious are these. Dental. This is a very important mode of transmission. We know that often there's bleeding when somebody gets a dental job done. Almost everybody is getting root canals and extractions done nowadays. And if the equipment is not sterile, if you're drinking from the same glass and washing your teeth after you visit a dentist, make sure it's a new glass, make sure the equipment is new. And so this is an important subtle mode of spread. These are the other modes of spread: intramuscular injections. As I said, children put toys into their mouth, same toy may be put into the mouth by another child, and that's how it can spread. Blood, of course, we know. IV drug abuse, where people share needles. Fortunately, not common in Maharashtra, but in the Northeast and Punjab, common problem. So most of the hepatitis C, which we see in the Northeast, is through IV drug abuse. Mother to child transmission, more with B than with C. And then we have all the tattoos and body piercing, which has become popular amongst the young population, which can spread these viruses. And of course, unprotected sex, if you have somebody positive in the family, can cause hepatitis B and C. So how do you care for your liver when you have a hepatitis? So there's no specific medication, and there are a whole lot of liver tonics in the market. Everybody talks of live 52. So a liver disease is equal to live 52. So most patients who come to me would have already taken live 52 even before anybody has suggested it. It has 52 ingredients, Ayurvedic ingredients in it. I'm not saying it's bad, but it has not also been shown to be useful in good randomized trials. So really, there is no medication. And because there is no specific medication, any medication is very good, because most of these patients would have self-limiting illness and would resolve on their own. So whatever one uses, people push water through the nose, put all kinds of medicated wooden twigs around their neck. So everything that one uses can be claimed to be of benefit, because the patient finally kind of improves on his or her own. And there are a lot of fads. That's what I want to highlight, that if somebody has jaundice because of hepatitis, it's not really necessary to go to a complete boiled diet, to stop eating haldi because you're going to become more yellow, or avoid milk. There are a whole lot of eating fads related to hepatitis. And I must say, just eat your normal diet. Eat what you like. You may not be able to eat fried food, and we're not suggesting you eat fried food or very spicy food. So eat what is acceptable to you. Most patients we see losing weight because they have been put on such a strict diet of boiled food and so many restrictions, that they're losing weight not because of the disease, but so many restrictions which have been imposed on them. Important thing is hand washing. I think the COVID has taught us how to wash our hands. Sorry to put it this way, but the importance of hand washing was always there. But hand washing is important because, as I said, it's a fecal-oral spread. And of course, one can give vitamins to boost immunity, also because these patients are not eating well. I mentioned about Ayurvedic medicines, or any allopathic medicines really are of no use for hepatitis A and E. And for hepatitis B and C, there are very specific effective drugs available, which we use in select situations, which I'm not really going to elaborate here, but just to know that there are effective drugs for hepatitis B and C. So what is the diet? Regular home food, which is palatable. Make sure the water is boiled. Now, this is again, I want to say that people often drink sugarcane juice as a treatment of hepatitis. And there's nothing wrong in sugarcane juice. It's a good source of energy and calories, but it's just the way it is made that we do not feel it's safe to drink sugarcane juice. It's not necessary, as I said, to eat boiled or oilless food. And I think all those who are high risk should be vaccinated for hepatitis B. We talk of all patients with chronic problems to get vaccinated. If you have any family member who is positive, then all other family members should be tested for hepatitis B. And if they are negative, they should be vaccinated. It's not uncommon to pick up a family member who tests positive when one family member has been found positive. So they may be totally asymptomatic. We often hear, why should I get my brothers, sisters, or children tested when I have no problem? It is important because that other person may have absolutely no symptoms. It has now become a part of universal immunization program. So all children would get this vaccine, but this is not true for all states. In Maharashtra, we have it. I'm not sure whether UP and Bihar have incorporated this as part of universal immunization, but till a few years ago, it was not. And then you have a standard dosing regime. Now, this is a picture which may be familiar to you. This was one of the pictures circulating in social media during the COVID pandemic, where you could see these long queue of people lining up on a couple of days where the government opened up the wine shops. Because people were pleading that they were going into withdrawal, there was no access to alcohol, and you can see that it is a big problem. People were willing to come out in the lockdown and procure their quota of alcohol because many people are dependent on this drink. And we have a whole variety which is available, right from Indian-made foreign liquor to the local brews and the best of liquors, as you may call it. But as far as the liver is concerned, almost all alcohols are the same. So we talk in terms of a standard drink or 1 unit of alcohol, which is about 8 to 10 grams of pure alcohol. So what consists of 1 unit for us? For us, 250 ml of beer is the same as 100 ml, or a half a glass of wine is the same as a small peg of whiskey, rum, vodka. These are also what we call spirits. So if you have a person who is having one small peg of whiskey, he is equal to having 250 ml of beer. And we know that a person who, because many times patients tell us that we are only having beer and wine, so it's safe. We are not having whiskey. It's not so, because you're not going to have 30 ml of beer. You're going to have much more of it. So it comes to the same. Finally, at the end of the day, what the patient is having is the drink, a standard drink, and how many grams of alcohol is he consuming. So whether it's beer or wine or whiskey or any of the hard drinks, as long as he is having X grams of alcohol, it all comes to the same, and none of them are really safe. Also, it doesn't matter whether he's having a local brew or whether he's having the best of single malt Scotch whiskey. They all are the same as far as the damage to the liver is concerned. So in that sense, it's a great equalizer. And there are some safe limits. So what are those safe limits? If for a man, it should be less than 2 units of alcohol in a day. And for a woman, it's less than 1 unit. Now, women require lesser alcohol to cause liver damage. So women are more prone to developing alcoholic liver disease compared to men. And they develop it much faster because they are deficient in certain enzymes, which can make them more predisposed. So there is an argument that alcohol is safe for the heart, so why not have it? But that argument doesn't hold, because we see that patients, once they start getting addicted, used to alcohol, the number of units they consume goes up gradually. It starts with social drinking. We see many medicos who get free access to alcohol in conferences, and then they get more and more. So they are first drinking in as part of the social gathering, and then they start drinking alone. Then they start drinking in the mornings, and that's how the problem increases, and one can get addicted. And so how does one really prevent this? So there are many support groups. There are, of course, medications to reduce craving. But what I want to talk about is a support group called Alcoholic Anonymous. I'm sure you've heard of it. It was set up as way back in 1935 by Bill Wilson and Dr. Bob Smith, who just struck a spontaneous friendship with each other, started chatting, realized that both had an alcohol problem, and they started doing the same thing to other people. anywhere, whether it's in an airplane, waiting in a lounge, in a party, wherever they met people, they would strike a spontaneous friendship, find out about their habits, realize that when they talked to them and counseled them and related to them what their experience was, people opened up and then started refraining. So there are no more than 2 million people who are part of this AA. Mumbai alone has 200 centers, and there are about 1250 centers all over India. And there is this website of theirs. And even in COVID times, they have continued to continue their online meetings. So this is good because there is no cost here. There's no class, caste, religious barrier here. People are just coming. People who've been off alcohol for more than 30 years. I used to conduct these meetings for more than 30 years, come, and they come because not only because they want to convince others to stay off alcohol, but they also come because they want to convince themselves that they have to stay off alcohol. Because a person who's been an alcoholic once, who has been dependent on alcohol, can go back to alcohol anytime, even after 20 years. So they want to do it for themselves and for others. And all they do is they talk about their experiences, and they are very open about it. There is no profession which is mentioned. It could be just about anybody, doctors, lawyers, scientists, and it could be an electrician, plumber, and they're all actually at one level when it comes to their drinking habits and addictions. So that's about alcohol. A little bit on drugs. As I said, there are many drugs, and I think I'll skip this, except that when you have a patient with liver disease, you have to be very careful about what drugs they can be given. There are specific painkillers. Only paracetamol is safe. There should be no other painkillers. There should be no sleeping pills which should be given. And there are certain do's and don'ts which we talk about to patients of liver disease. They need to get their ultrasounds done once you have cirrhosis for tumors which can develop. And then there are certain other things. They should be vaccinated so that they are protected from other agents which can damage the liver. So this is Paul Farmer's famous statement that there is a big gap. There's what is called the no-do gap. You know a lot. You know that there are effective therapies, but the often neglected work of getting effective therapies, which is the no, to the people who need them is not theirs. So you know a lot, but you're not able to deliver, and the people who need them are not able to access it. And really what we need to do is to narrow down this no-do gap. It's been very well put. So a little bit on the pandemic which has consumed our lives in the last year, and probably it's going to be this year as well, the way things are going. So this virus, as I'm sure all of you must be knowing, has these spike proteins which are being talked about. And these spike proteins or glycoproteins are the real target. It is the spike proteins which are used to get attached to the host cells. And these are the key targets for vaccines. Even the antibodies which we are now getting to measure, what is called the neutralizing antibodies, are antibodies against these spike proteins. And these basically proteins get attached to what is called ACE2 receptors in the liver cells and the bile duct cells. And that's why this virus can affect the liver. Fortunately, it is not to a large extent, to a mild extent. And there are certain drugs which have been used for treatment of COVID, which can also affect the liver. One such drug which you must have heard of is remdesivir. And there was another drug which is now more or less not used, tocilizumab. So both these, one has to be careful. And especially if you have a pre-existing liver problem, then one should have been more careful about using these drugs. As I said, COVID can affect the liver, and you have so many patients with the metabolic syndrome and cirrhosis who it has. So if you have a fatty liver, or if you have the metabolic syndrome, and if you have COVID, which many of our patients had, they tend to have more severe disease. So in that sense, one needs to be careful in any case. What about the vaccine? Is it safe? Is it safe in patients with liver disease? And honestly, there is no data at all. So our societies, our liver societies from the West and Indian societies have suggested that any patient with liver disease, it is safe to take the vaccine. But I guess it is not really based on solid evidence. It's based on the fact that it's safer to take a vaccine. We know how the whole process of making vaccines has been fast tracked. So it's safer to take the vaccine than develop COVID with a liver problem, which can be more dangerous. We still don't know which is the safest vaccine, what will be the results in patients of liver disease who get the vaccine. All this really needs to be studied, and we await those results. So I would like to end my talk by saying that if somebody asks me to drink but not the way we Indians like to drink it, with milk and sugar, it should be black without any milk and sugar. And it has been said that 4 cups of coffee, black coffee a day, will keep the liver specialist away. Thank you.
Thanks a lot, ma'am.
Yeah.
Thanks a lot, ma'am.
Thank you. Excellent lecture.
Yeah. We all have learned a lot today and understood much more about our liver after your talk. I'm sure we all will be handling our livers more carefully now. Ma'am, you explained us the varied functions of liver, which protects our body from harmful substances or toxins that we put in our body either deliberately or unintentionally through food we eat or drink. It seems the liver is an organ only found in vertebrates. You also explained how liver protects our body from the toxins by cleaning the blood from chemicals that are within our body because of our day-to-day activities. This important organ is helpless to alcohol, viruses, medications, and certain autoimmune. However, the emerging major culprit affecting people all over the globe and India is fat in the liver. The